The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and thank you for joining us on this virtual educational seminar. It's crazy to think that we were all supposed to be together today in Des Moines at the annual conference, but we're thankful that you're here joining us. Also extend my thanks to NACO, the Professional Development Academy, Tim specifically, and then all of our panelists that you'll hear from today. They've done a lot to prepare and really bring you a high quality leadership training for the next 2 days. And also thank you for attending and really valuing this education as we move forward. A couple housekeeping items. We will have everybody muted. We'll ask that you use the chat bar and really encourage you to use the chat bar for ongoing discussion that comes up, questions that you may have, or anything in between. If you do have any technical issues during the broadcast, feel free to email support@iowacounties.org. One of us on our team will be happy to get back with you shortly. The first thing I am going to let you know about is a new program that we are rolling out in January of 2021. You may have heard about this as we've come around to different district meetings, but it is the first of its kind continuing education program specifically for Iowa County supervisors. It's called the Certified Iowa County Supervisor Program. I realize all of you aren't supervisors on this specific educational program, but we thought it would be important just to make you aware of this. So registration is now open, kicked off registration earlier this week, and then a full rollout will happen next week with more materials being provided to the supervisors across the state. So if you are a supervisor and you are interested, please know that this program is free. It's a 2-year program. And again, it will begin in January of 2021 with a new county officer school, and all the programming will be contained within the conferences and events we already offer and the supervisors already offer, as well as virtual events as well. So if you are interested, or if you think your supervisors may be interested, make sure to reach out to me, myself, Tim Schumacher, who is the Emmett County Supervisor, chairs our education committee. And then we also do have district leadership on the committee as well. So if you know any of them, there's more information on the ISAC website. And again, we will send out information on September 1st next week. So we look forward to having a big first class next year. Now we will move on. I will introduce our leader at ISAC, Bill Peterson, the Executive Director.
Thank you, Rachel. Great to have everybody on the call today and participating in this webinar. I think one of the things that is really critical as we, as individuals, try and do our various jobs, whether it's in a county or whether it's at the association level, is making sure that we take advantage of ongoing educational efforts. And we are very thankful for the sponsorship of the National Association of Counties and also for the Professional Development Academy for partnering with us on this program today. In a minute, I'm going to introduce Dr. Tim Raschulte, but I just wanted to remind you that those individuals that are participating today will have an opportunity to participate in what is known as the NACO High Performance Leadership Academy. And this NACO High Performance Leadership Academy is a 12-week online course that can help you learn more about how to become a leader and what it takes to be a positive leader in today's environment. So I'm just finishing my 4th week in the course, and I've already learned a lot, found out a lot of things that I could be doing that would help me do my job better, but it really is a unique experience. So for those participants, there's an opportunity for you to apply for one of the 10 scholarships that would allow you to take advantage of this course. And this course has a $1,995 value. And I just think it's a great opportunity for you to participate. We appreciate Tim and the Professional Development Academy for helping us sponsor those 10 scholarships. It's really valuable for us to have that partnership. Now I want to just take a minute and introduce Dr. Tim Rischulte. Tim is the CEO of the Professional Development Academy, and I don't want to spend too much time talking, but he has many, many years of experience in doing leadership training development, and actually putting those leadership training qualities and skills to work as a leader across the country in helping other individuals improve their ability to do their job as a leader in the organization. So with that, Tim, I'm going to turn it over to you, and I'll let you get started.
Yeah, thanks so much, Bill. I appreciate it. It's great to be with everyone today, and I will be facilitating a panel discussion. I encourage all of you. We've got well over 100 people on this webinar right now participating, and like mentioned by Rachel earlier, it would have been great to be face to face, in person, seeing you and working with you and learning from you and thinking about what the future can be as we think about the business of our counties across the state of Iowa. But we're here. We're here in this virtual environment, and we can still engage in that same amount of learning and collaboration, sharing with one another, learning from one another, and also envisioning what is to come. And we're in this virtual environment because of a lot of change that's happening. When we think about change, we obviously can think about what has been happening earlier in the year, in spring, with COVID-19. But you all, specifically in Iowa, just the last couple weeks, have been dealing with some pretty devastating weather systems that come through. And I'm calling in right now and participating from Multnomah County in Portland, Oregon. Portland's in Multnomah County. And one of the things that we hear quite a bit on the news where I am, maybe because of proximity to California, is the California wildfires. And you might hear about that as well on the news. And I bring that up just to put it in perspective, that I think a lot of folks across the country don't really understand about some of the change that you all are faced with right now. California's getting a lot of news right now because there's 1 million acres that are consumed with wildfires right now. And that's an important number simply in perspective of what you all have dealt with. Over the last 2 weeks, you've lost 14 million acres of crops due to some of the weather systems that have come through your state, devastating some of the counties, especially Cedar counties and others in Iowa. And so, we're thinking of you. Our best thoughts are going out to you and your families. And as you continue to manage the business of your counties, there is a significant amount of change. And if you have studied change, if you've thought about change, if you've read about change, you've probably seen it in Harvard Business Review and Fast Company and GovTech Magazine and others. Words from John Cotter. John Cotter is a foremost expert around change management, and he says often it is the ultimate test of a leader, how to plan, execute, and sustain positive change. And there's a significant amount of it happening right now within our counties, and so it is the reason that we're focused on some of the conversations that we have right now. And it's a great reason to have the panelists that we have and you all joining us. And I do encourage you, as what was mentioned at the top of the broadcast, please feel free to chime in the chat box and use the chat box to raise questions and make comments. We will be checking that throughout the time that we have today and tomorrow, as we talk through some of the aspects of change. And we can think about all of the work that you're doing, what makes up the business of your county work every day. And every aspect of it has been modified this year. There has been a significant transformation and shift that has occurred in the way in which we think about the services that are being provided, the consumers, the users of those services, and how we carry those out, how we provide those services from the staff and the teams that we have conducting that amount of work. And it has been significant. And so as we think about, some of it, it's hard to get away from some of the COVID details. These numbers have likely changed from the time that I pulled them into the charts. But, we are in this often referred to as this time of unprecedented change, this time of crisis almost. And we do have this layering effect of we're dealing with COVID, and we have to deal with the storms, and we have to deal with how do we get individuals back to school, and we've got the elections coming up, and we've got fill in the blank. And no doubt you can fill in 18 blanks of those things as you think about your day. And so it's because of a lot of this that we wanted to pull back for this hour and a half or so today and again tomorrow to think about what it means to lead in such times, as well as to be a teammate in such times, and what it means to think about how we carry out and go about our work during these times, when we think about the importance of all of the county work that takes place in Iowa and across the United States. It is the foundational element of the economies that we all benefit from. And so we are going to focus on leadership. We're going to leverage the aspects of expertise that we have on the panel, and I'll facilitate the conversation today. And again, I encourage you all to chime in as well. And just to kind of build some level of engagement, you all are very familiar with your Iowa map. You know exactly what county you're dialing in from. But one of the things I'd love, just so that our panelists can see it and so that you can represent your county, please go to the chat box feature in the little go to webinar dialog box. Just type in the county that you're dialing in from right now, the county you're representing, the county that you're working in. You can broadcast that to someone specific on the Iowa team or to the organizers, just so that we've got a sense as to who all is in the group. We've got 112 people on the call right now, and it would be great to get some folks just to chime in. Where are you calling in from? Just so that we've got a sense as to where folks are and the counties that you're representing. Thank you for doing so. And as we do that, we'll keep an eye on that so that we can see the representation across Iowa. And while we do that, I'd like to introduce to you the panel that we have. Kevin Green is the health director, as you can see, from Siouxland District Health Department. Tracy Marshall is the treasurer at Cass County and the prior president of NACTFO. Ryan Doctor is the auditor at Sioux County, and Dr. Debbie Stoudemire is the chief administrative officer at the National Association of Counties at NACO. And I want to, first of all, welcome the panelists here. Thank you all for joining us. It's great to have you with us, and looking forward to this conversation today and learning about both your leadership aspects, the impact that your team has gone through this year, and what they have rised up to accomplish. Many of the teams, we hear about what they have been able to accomplish and overcome the adversity and some really challenging situations, complex situations. And we're going to get into a lot of that conversation today. So again, thank you all for joining the panel, and we're looking forward to the discussion. If anyone from the audience who is dialed in, if you have questions, feel free to post those in the chat box. We will be picking those up. One thing I think I'd like to start with, and Kevin, if you don't mind, we'll start with you, and we'll just kind of go down the line. And so Tracy, and then Ryan, and then Debbie. Let's go back to the spring. It was mid-March. About March 10th. Earlier than that, we obviously heard about COVID and the possibilities of what would happen. But it was really in the middle part of March that things started to shut down. People started to work remotely. And Kevin, I'd love to have you start in going back to that time as a health director, specifically at the health department. Many times at a point of a crisis, there is usually a reaction, a response, and then a recovery process. And I think all of us are still probably in that recovery and responding process. But can you walk us through and talk a little bit about that first step, that reacting step, and then what were some of the first steps, the first responses that you and the health department started to take on? And I suspect from your perspective, it may have started a long time before the rest of us in March. Yours may have started earlier in the year. Kevin, again, welcome to the panel. Thank you for your participation. Would you mind walking us through that react, response, recovery process relative to COVID-19?
Sure. I think the first part, when you talk about it, we started unfolding it, seeing it unfold in the eastern part of the state. And we're clear to the western border. And so we had an opportunity to kind of observe and to watch and to, what I would say, get a little bit acclimated to what was coming our way. And I think our first part of the reacting is really taking a look at what are the key pieces that are going to potentially make us successful in dealing it. And I know we had to sit down and prioritize. So we looked at, number one was the aspect is we didn't know the impact of the disease unless we had testing available. So we needed to jump into the realm, and we weren't sure what was coming from the state level. So we decided from the local level, we needed to reach it out to our consortium of individuals. Within that, then we kind of networked together. We put together a testing. By the first part of April, we were beginning to test. Our first confirmed case didn't come until March 20th. So within 10 days to 2 weeks, we had testing going on within our local community. I think that was part of the reaction. The next step was just internally. We knew that because we have a long history of doing disease investigation, we needed to know for what to do for how are we going to do contact tracings as our number of cases increase. So I think in looking at that is going through to do an assessment, the kind of response to is we're going to hire, what's it, internal. I think one of the things that thus at the top of the leadership level said we had to establish priorities of how we were going to respond and what we were going to do. And our number one priority that we took a look at is what was within our power and authority to do to assure that we maintained our staff, that they weren't furloughed, because we had public health work to do. It may be work different than what they previously ever had done, but how did we equip them? How do we support them? And how do we integrate them into our response plans? And I think those were some of the first most important things that we looked at doing. As this unfolded, we waited about 10 days before the cases started coming in. By the end of April, we were getting, at one point, I think we had 400 in one day. And so we were in that active level of response, but we had set up a routine. And I think some of the things that we did internally was we looked at communication was a key factor of keeping all of these. I've got 40 staff members out of 63 actively involved with it. How do we keep the realms of communication open? And I think really within the recover is what it is that we're still in that process. We're kind of caught as, I call it, like I said, we're in the midland process. We're recovering where we're beginning to open up for services again and bringing clients back inside the building. However, though, the next wave that's going to occur is public health is primarily responsible for the distribution of the vaccine when it's available. So we are now back into taking a look at that reacting, responding, what does it look like, how do we do it, while we're still maintaining current response efforts. So I think those are all the factors, that cyclical type thing that we worked through. We had to make a lot of decisions on the fly, and there really wasn't necessarily time. What we're thankful for is we did go back to have a pandemic response plan. We had a continuity of operations plan. We had documents we could go back to refer to give us some guidance.
Yeah, that's great. Thank you for that. I know that we're going to get into some of those plans, and we'll likely take a poll of some of the participants as to how many folks have such plans in place, how many executed those plans, and how many worked as they were intended to work. And I suspect too, Kevin, we'll probably come back to how you and others do kind of walk through that decision framework around setting priorities and understanding what is in your control and authority and decision framework in moving forward. But I certainly appreciate the timeline of events and how it is that you initiated the response and then ultimately working toward the recovery. I'm sure there's a lot of folks who also have a lot of questions regarding the distribution and of that, whatever the vaccine might be, when that might be available. Those might be some other questions we get to in the future here on the call. But Tracy, would you mind walking us through a little bit about your perspective and your experience relative to COVID-19 regarding the reaction, the responding and recovering process as it pertains to Cass County?
Sure. Tim and Bill and Deborah, thanks for holding this virtual webinar. COVID hit us all very differently from different offices, from different courthouses across Iowa, and not only Iowa, but across the nation. Everything started shutting down, the stores, manufacturing companies, and more courthouses across Iowa. By this time, here in Cass County, we've been having people come to Cass County for their driver's license from everywhere. Hotspots. And so my staff was getting a little worried, and we had no protection in place for COVID. It was a little scary. I contacted a few department heads here at Cass County. We held a meeting. I stressed my concerns, and we all agreed we should probably shut down to the public for the safety of our staff and Cass County citizens. We then planned a meeting with the department heads and the Board of Supervisors to close the courthouse. Our Board of Supervisors were not in favor of closing the courthouse. We had several different opinions and mixed feelings. Then we started discussing different offices closing, and no one wanted that to happen. We wanted to be in unity. So we come to the conclusion to close the Cass County Courthouse to the public. So we closed on March 18th of 2020 due to COVID. We all had our staff coming in, split days, some every other day, some every other week, and whatever worked for their office, just in case one of us ended up with COVID. None of us wanted our offices to shut down and quarantine for the total 14 days. So at that time, working staggered hours seemed to make sense to limit the time our office would be closed for sanitizing. In my office, we continued all services except for driver's license due to the courthouse being closed and people traveling here from everywhere. We continued to proceed all tax and motor vehicle transactions. We met customers at the door for all transactions they needed done. Business pretty much went on as normal as could be. It was March, of course, we're collecting taxes, so I purchased a drop box for the convenience to drop tax payments in. So my staff and I were trying to prepare a plan for more staff coming in because our phones were ringing off the wall and we were struggling just keeping up with the phone calls and everything. So we continued this way until the Board of Supervisors decided to open the courthouse to the public on May 1st of 2020 without any restrictions. We had no communication about opening until Monday 27th, about 5 p.m. We had several questions that were unanswered. Was someone going to be monitoring the door and control the quantity of people in each office? Was someone going to take temperatures and ask the COVID questions of people coming into the courthouse? Was someone going to monitor the hallways to make sure there was social distancing and wasn't too many people at one time? Well, none of these questions were answered or talked about to our knowledge. And we opened to the public without any guidelines to go by. We did have chairs in the hallway that were spaced 6 foot apart for social distancing, but nobody monitoring them. I had purchased germ shields, so was somewhat prepared for customers. However, other offices have not ordered anything at this time and were not prepared. Then I had to struggle for my staff to social distance and for the customers to social distance coming into my office, which seemed nearly impossible at that time. We have an open office concept. My staff's desks are bundled together. So we figured if one of us ended up with COVID, we would all get it. With the public, we decided to do appointments only to help control the number of people in the office at one time. My board of supervisors didn't like that idea either. There were 2 life-size signs in the hallway, so I took them in my office and was able to stop people from entering the middle section. So if you look at the pictures, you can see the big signs there. I tried to cover the middle there. This allowed us to have 2 people in the office at one time. The staff was very leery about the whole situation and how everything would work. But we worked through it as a team, and we learned a lot about each other, our customers, and other leaders within the courthouse. After about 2 weeks, our phones were still ringing nonstop, and we didn't hardly have time to keep up with our customers because people kept coming in without an appointment. So we started brainstorming on how to make the office more efficient and handle more than 2 customers at a time. I was looking at how these life-size signs were made and called a gentleman who helped me remodel my office. He came in and we talked about how to make partitions, like a booth, to allow more customers at a time. So we went to his shop and he was showing me what he had there that we could use and make partitions. Then we started working on the partitions. He delivered them, I stained them, and we had them all done within 4 days. This then allowed us to have up to 5 people in our office. So you can see the more germ shields and the partitions there in the office. After these were in place, we decided we were not going to require appointments for motor vehicle and tax. That helped with our phones ringing a little bit. And that's all I've got for now.
Yeah, there's a lot that we'll likely get into within that as well, Tracy, especially, I'm sure your staff were not the only ones who were leery, and I'm sure that you and your staff were not the only ones across Iowa, around the world that got to know each other a little bit more. And as you were talking about the timeline, it's interesting too, especially in a crisis such as this, that a lot of times there's not information. We just don't have the information. We don't have the answers, as you talked about, and yet at the same time there is the pressure, and in some cases, based on the work that we're doing, the absolute need. And I think about the work that you do as a treasurer, and the work that you all on the panel do at various aspects, especially of the healthcare side of things. There's an absolute need for the community to remain open, or at least remain in business operations to carry out the work, I'll bet in some cases different than it was in the past. And so I know we're going to get into some more of those conversations about how do we as leaders, how do you all as leaders make decisions without having all the information, and how do you then execute those decisions, and how do you work with a staff who is leery and still has a load of questions, which adds a lot of anxiety for them, but it also adds a lot of resistance to any of the actual change that is actually taking place. Again, the John Cotter quote is, the ultimate test of a leader is trying to create a new order of things, to navigate aspects of change. And a lot of times that is overcoming the lack of information, the multiple stakeholders, and the complexity of diverse stakeholders that you have, those that you need to serve in the community, the staff that you have, and the list goes on of the different stakeholder types and groups that you are trying to work with and work for. And many times they have competing ideas as to what is the way forward. And so navigating all that, I'm sure we're going to come back to some of those topics and some of those questions, and we might come back to some of the photos that you have. And I'm just going to slide back to one of those, this one right here, where you've put up the germ partitions, as well as the plexiglass between the customers and your staff, your team. But I will say those partitions that you noted as being stained there against the wall, Those look fantastic, by the way. So great job on, the resourcefulness of putting that together, and just the craftsmanship of look fantastic as well. So not only are they functional to execute the business, but they look great as well. So I wanted to, offer some congratulations on one, continuing the work, but then also just aesthetically for your customers and your staff and others to help not be more of a distraction than otherwise within the office. They look fantastic. So very nice job, Tracy. Well done. Ryan, would you mind walking through your perspective as the auditor of Sioux County? What was the reaction like, in March and the months thereafter as you got past the reaction, started to work on the response and the recovery from COVID-19?
Yeah, sure. My first reaction was really to begin asking questions of myself and other county leaders of what we needed to do to protect our employees and people that we're serving through the public, and also while trying to maintain those services to our citizens. So from there, we had a few meetings that included our board and department heads, and we initially decided that first week we're going to have some limited hours to the public that we're going to be open. But then we quickly realized through the process that that wasn't going to be a workable solution. We really needed to close the facilities and then take people by appointment only. So we just couldn't keep up with the demand of cleaning and multiple entrances, things of that nature. So that was kind of the initial reaction, but kind of four things in response to that would be, specifically in my office, we're responsible for elections, and we had a primary election looming in early June. So we immediately put together communication to our election workers to get an idea of how many people we're going to be able to recruit. That would determine how many polling locations we're going to be able to open. That was kind of a specific thing for my office. But beyond that, other items that were kind of more of a county-wide response were developing policies in regards to people that might be returning from vacation or out of the country or just traveling amongst the state. What kind of travel guidelines and isolation guidelines are we going to implement for employees? And well, we were really fortunate to work with a lot of other counties who had been thinking about these things already and had policies in place. So we were very thankful to basically borrow what they've put together. From there, we also worked with, working from home policies. We have some people that can do that, but, many people have a public-facing position. Their job is to work with customers as they come in. So kind of navigating those things too, like I said, taking people by appointment only, doing some pre-screening questions, things of that nature. Another thing that we did, and it's maybe not all that innovative, but I think Tracy mentioned this, we purchased a drop box, kind of a general use drop box for outside of our courthouse. And that was really beneficial. People can do their business very easily through the mail, through the drop box, through email or fax, or even over the phone. People really like just to come in and do things in person. We really noticed that the older generation just really was getting tired of being stuck in their homes and just wanted to get out and see people. So they'd come out and try to get in the building and realize they couldn't, so then they just drop off their paperwork. So and kind of the final response just in general is we worked with some contractors to get some really nice barriers installed on our countertops for the offices, and just provide that layer of protection between us and the public. So that creates some comfort level for our employees and for the customers. And in terms of the recovery process, I think we're just a little bit into it right now. We opened up to the public from 9 a.m. to 2 p.m. currently, kind of limited hours. We did that in early July. So we haven't fully opened back up yet again, but we're working towards that as long as you know, things hopefully progress in the right direction with the number of cases. But and we're also waiting on some equipment that will allow us to disinfect areas very quickly instead of standing there with a bottle of disinfectant spray and a rag cleaning things down. So we're working towards that end goal as well.
Yeah, thanks, Ryan. I know that we're going to come back to some of the comments that you made as well, especially learning from other counties, you know, learning from one another. Kevin talked about that a little bit as well, where he saw, you know, some of the effects on the east side of the state and how that was progressing toward the west side of the state, and what that meant in terms of learning from what was going on and preparing, I'll bet, you know, in a short amount of time, not a lot of time there to prepare, but that level of collaboration, that level of coordination, you know, across county lines and across state lines and across the nation can be extremely valuable. And I know that we're going to come back to that. And but before we do, Dr. Stoudemire, I'd love to get your perspective too from NACO, because, you know, this happened almost like right after the legislative conference that NACO holds every year in DC. And I know that a lot of folks were looking forward to being in Orange County this year for the NACO annual session. That obviously did not occur. It was held, virtual sessions were held in its stead. And Debbie, I know that you've got like 100 or thereabouts folks on the NACO team. And so a big impact on that team of individuals and the work that you do. What was the NACO React, Respond, Recover process like from the inside as you oversaw that and experienced it, Debbie, as a CAO?
Thanks, Tim. Good afternoon, everyone. And certainly thank you for allowing me to be part of this discussion. Like everyone else, it actually caught us by surprise. You know, it's hard to believe it's been 6 months since we've actually been in our office full time. But for us, the first thing we wanted to do was take care of our employees. We acknowledged that this is because of the uncertainty, the staff, along with the leaders, had no clue what to do. There was so much confusing information going on. So we wanted to take care of them. We acknowledged that they had loved ones they had to take care of. The kids were not in school. You know, at the time, people had to stock up on necessities. You couldn't find paper products or anything. So the staff, they had to stay healthy. They had to stay safe, and all the while trying to do their jobs. And so we had to show empathy. We had to be flexible. And in terms of the leadership, we had to do that. So what we immediately did was we required everyone to just stop telework from home. 100% people worked from home. The next thing we wanted to do was to maintain an open lines of communication with the employees. We wanted them to understand that we are going to share as much information with you as we could about this current situation and what steps that needed to be taken to address the issue. And if there were any mitigating steps recommended by the authorities or the CDC, again, people didn't know where to go for information. They just weren't sure. We wanted to be that source for them. So we provided as much information as we could. And then we realized communication was key. We had to figure out what kind of tool we wanted to use to communicate with. As you can imagine, when it first started, people were using all kinds of virtual tools. We had MS Teams, we had WebEx, we had, you know, whatever platform out there they were. But we internally had to figure out what is the best tool for us? What are our needs? And let's decide what tool will help us meet those needs. What we did was we made sure first everyone had laptops. And fortunately, most of our staff did have laptops. In addition to the desktop, we always gave people laptops. And the other thing, we wanted to make sure that our office phones were connected to those laptops. Certainly people couldn't be in the office to have phones. So we wanted to be certain that our phones were connected to our laptops and our mobile device. And so if someone were to call the office, there really was no disruption in how they contacted us. The next thing we did was we set up regular briefings with our staff. We wanted to create some type of routine with the staff. Again, this whole incident, this crisis was so uncertain. And we wanted to use that to build trust and confidence with the staff. And so in addition, the leadership met every morning. met every morning. We wanted to be certain that we shared as much information with each other as we could. And then we met with our teams every day. We wanted to ensure the employees knew what to do if there were any concerns about their colleagues being infected, what was going on in the office. We also reminded employees about our applicable HR policies and procedures, including teleworking. And we realized that our current telework policy pretty much had to be thrown out the window. So we had to make some changes. Obviously, there are some things that still withheld in terms of your ethical behavior and having meetings at your home, the insurance and all of that. But in terms of not having kids in the office, not, at home, not taking care of your loved ones, of course, we had to be very flexible with that. And then we wanted to ensure staff that we established protective measures like everyone else, including NACO provided masks for our employees. We assured them that we were disinfecting the hospital with hospital grade disinfectant. We installed plexiglass, social distancing signs. We did everything that CDC recommended. We did. Now it was easy for us because no one was in the office, so we could easily do this. And the other thing is we try to anticipate questions. As you can imagine, HR was receiving all kinds of questions from staff. And so what we did was we compiled those questions and answers and then anticipated what other questions people had. And we put it together in a format where we could send it to staff. And that really helped staff an awful lot. I think it helped calm them a little bit to know that we were doing everything we could. It answered every question that they possibly could think of. And what we did was we didn't officially open. Basically, we followed the DC Mayor executive order. But what we did was we have what we call a soft opening. So on July the 7th, we allowed staff, for those who wanted to come to the office, to come in the office. And this is after we did everything we could to ensure their safety. We were following all of the CDC guidelines. We were in compliance because we understood that some staff were having a very difficult time working from home. We realized that we had some staff who are here, their family is out of town, they don't have a lot of family here or friends, and working from home every day was just causing an anxiety, especially those who were already existing underlying mental and emotional issues. So we're now allowing people to come in the office if they feel it's necessary to come into the office. I don't anticipate we'll officially open the office until probably 2021. And then I can assure you it's not going to look like it did prior to COVID.
Yeah, a significant amount of change for sure. And, just for those taking notes and keeping score of what's been going on, I think some of the key takeaways thus far, at least for me, based on my notes, is that the increased aspects and regularity of communications. Ryan talked about immediately pulling board meeting together and having regular communications. Tracy talked about trying to get answers to questions that people had within the staff. Debbie, you just talked about, the team coming together on a regular, every morning for a stand-up and a briefing that then gets translated to the divisions and departments that those leaders oversee on a regular basis throughout the day, making sure that people have what they need. When we think about leadership, we could have started this conversation about, when we think about great leaders, what do we think about? Sometimes we think about individuals that take on very heroic acts and, they've got clear vision and, they're assertive and they're strong. And really what we're realizing, especially in times of crisis, the great leaders, they need to have focus on what they're trying to do. They have to be able to prioritize, but they have to have this, as you talk about, Debbie, this sense of empathy, compassion, and care in the services that you're carrying out. And that starts with the people that are carrying out those services. And so how do we provide that within our teams so that they can go about and do the great work that they're doing? And Debbie, I've got a follow-up question for all of you, and we'll start with you. You had mentioned it probably won't be until 2021 that you're back in the office. I know that you were 100% remote for a while. Some folks in the NACO office are coming back to the office now and working out of the office some of the time for some folks to carry out that work. As you think about the one question is, are there folks that have COVID-19? Have they tested positive that you're aware of within your team? And if so, what was the additional reaction and response to that? And whether they have or not, what do you think some of the future is going to look like in terms of bringing people back to work versus having the flexibility to work from home? Will they have the option to do that within NACO, or do you know yet, or are you still working through some of that?
Well, we've been very fortunate that no one that we're aware of has have tested positive for COVID-19. But it was important for us to share with staff if you did what you needed to do, and if you're in the office and you become ill, what we needed to do. We made sure we have a room set aside for if someone became ill, that they can be isolated in that room. We share that with the staff, but we haven't had any. We haven't had any issues. We also have procedures in place now. So when we do start seeing staff come back on a regular basis, we will be taking their temperature. Staff knows they cannot, when they come in the building, they have to let us know, our facility manager know, because we want to be certain that we can conduct the tracing if we have to. We get a list every day from our data watch security people to let us know who's been in the office and who hasn't been in the office, which is good for us because if someone comes in the office, we want to be certain that we go right to their office, disinfect their door handles, and just give that little extra attention. As I said, we probably won't telework. We probably won't come back to work fully. I doubt that it'll be fully by until 2021. But if nothing else, this has shown us that everyone they don't have to be in the office. This is honestly has, as I always say, we had a plan in place, but it just showed us that part of our plans can be completely changed when dealing with a crisis like this. Staff have asked us, they're like, listen, I'm more productive at home than I was in the office. So doesn't it make sense for me to continue working from home? And so we have to look at all of that. And as I always say, and our CEO always says, it's based on trust. If you have an employee who performs well and you trust them, and if they want to work from home, I don't see any reason not. It's, with performance come rewards. And this is a privilege. It is not a benefit. It is a privilege to allow you to work from home. So I can see, I read a lot of the statistics, and it shows that for the most part, moving forward, 2/3 of the employees will probably come into the office, and 1/3 will probably continue working from home. So I think we're probably planning that type of scenario as well.
Yeah. And Ryan, how about you in Sioux County? Any of the team there testing positive for COVID, and what was the response to that? And as you think about your work, are you thinking about more flexible work schedules where some folks do continue to work from home, get to work from home, additional flexible hours throughout the day? How is it looking, and how do you foresee the at least the near-term future?
Yeah, so in my office specifically, we have a total of 6 employees, including myself. So, and right now, we haven't had any positive confirmed cases within that staff. We've had some scares here and there, so we've taken the appropriate action of, okay, you've possibly been exposed. We're waiting on tests from the person who may or may not have COVID. So, but so far that's turned out pretty well. In terms of working from home, we're a pretty public-facing office, so we don't have too many things that would allow employees to be working from home without creating additional work for staff that's present in the office. When it comes to elections, there's certain systems we actually have to be in the office in order to use them, so we can't be working on those from home or remotely. So in that regard, yeah, we just really don't have too many employees that could work remotely. at least within my office. That might be different for other county departments. There's some, especially department heads, maybe don't need to be in the office, but they can work remotely. But it's really, we kind of left that up to each department head to determine what's best for their employees and what might work for them.
Yeah, thank you for that. And this is a follow-up type question from a post that we just got in the chat box, which is, how many folks, what percentage or number are still working from home, and how long do you think that will continue? And Tracy, what about you in Cass County? Anyone tested positive for COVID-19? And did that, how did you respond to that? And what is the work situation right now with working remote, working in the office, and what might that change? What, if there are going to be any changes to that, what that might look like over the near future?
Like Ryan, we're public, very oriented with the public on our work. So I have not implemented any work from home for my staff with our DOT system and stuff. They don't allow us to work from home. I could as the treasurer work from home, but I am coming in. We're all coming in full time. We have had a couple of scares, just with maybe possible contact, but tests come back negative. So we've been pretty fortunate here.
Yeah, that's great. That is very fortunate. And Kevin, I mean, it sounds like it'd be great to, one of the reasons I want to kind of come back this way and finish this part of the panel discussion with you is, I mean, as the resident expert on, health and safety from a health perspective, it sounds like a lot of great things are being done. There are safety features being added within the office. There are safety features and precautions being done as people come into the office. And then once they leave the office, there's cleaning that's happening, things like that. What should we be doing in addition to that? What are you doing in addition to that with you and your team as we think about continuing to respond to this crisis? And how has the work situation changed within your county and across the department?
I think as we looked at it, up to one point, I've got 63 employees out of the organization. And at one point in time, I had about 33 of those, I think, were working from home. We're able to accommodate that because the contact tracing we worked through, that we could do that in an online environment and to be able to get the data and the feedback from that. The one thing that I think kind of led to that prior to is that as we approach this, we quit talking about if we got the first case, but it was when. So it helped relieve the anxiety. We've had actually 4 active cases within the 63. We do have our setup is where we limited the public input coming into it for services. All of my staff have either offices, cubicles. They are about 6 foot tall, so they have some of those barriers. I think some of the things that people need to take a look at now is really just the, you can do what you can want for your employees, but I think what it's trying to figure out is how do you manage the public that's coming in? One of the things that we actively have done is we have not brought for our immunization program. We knew that we had suspended that at the 3rd week of March. We needed to get kids protected again. It was time to do it. I had a group of staff come to me and they said, we're interested in doing those in a drive-through situation. So I said, okay, bring me back a plan, get me a list of supplies you need. Let's go through and review that. So I'm happy to report now after starting that at about the 2nd week of April, we essentially have moved through the infants and we're up to the adolescents that we have got them caught up as far as the immunizations. And it's all due to the work that they did. And in fact, they don't want to come in until the middle of October because it's so much more efficient and safe in what they're doing. I think some of the other things you need to take, there are the sanitation practices. I think the barriers. What I say over and over again with people is that we as an organization, all organizations, schools included, are doing our darndest to try and prevent and reduce the impact of this on our employees and on the public. What's really beginning to catch us, and it's been symptomatic and of the whole time, is that it is the informal social choices of gathering that are occurring outside the workplace, outside our systems, that are truly beginning to create a lot of the cases that are experiencing it, and that's what's bringing it back into the workforce. We went through that time with a lot of guidance because we had, there was one main industry that was really impacted by it, lots of cases. When you took all those cases, they linked into about every workplace in the county. They had spouses, family members, close contacts, that type of stuff. We really looked at getting them isolated. And I think the other part is just with your staff, being realistic of the aspect if they're not feeling well. Tell them it's okay. What are your personnel policies? What's the flexibility they have? We have flipped some staff that have just been concerned about possibly a close contact. We've been able to flip them back into a work from home situation. We've been able to accommodate that because of the work style that we actually have. And in fact, I still have 3 because of underlying conditions and risk factors. We've continued to be able to support them in a work from home environment. The other interesting part is just from the concept of work from home is what motivated us to bring them back into the offices. There were clusters of staff that actually requested to be brought back in. Their duration of staying at home, working in that situation, that environment, they enjoyed it at that point in time, but they were comfortable. They wanted what limited interaction and that sort of stuff would be occurring when they came back into the workplace. So I think it was really trying to work with the staff of mitigating what's best in ours as an agency, but within also the best interest of them as staff members here. But I would say the sanitation, the social distancing, and just reminding your staff that this is not just a 8-hour job during the day. They've got to be on alert for 24 hours. If they're going to choose to go out to bars and restaurants in mass groupings, there's a greater likelihood they're going to show up with something that's going to impact their ability to report to work.
Yeah, it's a great reminder and a great perspective that, focusing on the not the if, but when. And I think that's true for all of us. It's great to have been fortunate not to have COVID. We haven't had a COVID positive in our team either at the academy. We still work remote. We're kind of like NACO in the fact that we've been remote since March 13th. We'll likely be remote probably until spring, if not later into 2021. We've got the ability in which to do that. Kevin, you had mentioned at early on in this conversation that you did have a pandemic response plan that you pulled out and started to implement. Was that plan effective? Were you able to follow the step-by-step kind of playbook or activities that were associated with that? Did you learn that it was incomplete when it came to a pandemic such as this? Or talk to us a little bit about that plan and how valuable it was and what you've learned from that since using it.
The real value on the plan, we realize that just like our continuity of an operation, till you're in the situation, you don't know if the planning you've done is adequate and appropriate. But what the plan did as we moved through that is it forced us into the topical discussions that guided us. Whether it was the right direction or not to do, it gave us the sequence of topics that we needed to basically be really discussing in our incident command team, which was a group. And that was kind of another thing is I did intentionally, when I put together the incident command, I did not put all top level management individuals into that. Because one of the things that I had to do is I had to reserve a few of those. It was grant writing season. We had business functions. Somebody needed to take care of the business operations side and services provided. So I needed some key leaders in that area. So I involved some of those in maybe the next level in the incident command. What it allowed us to do in that group then is we could work through that pandemic plan. We could talk through some of the topics that were in there, how to relate to what we're doing, and how did it give us guidance as what we need to first off initially do and what's the planning for the future. So I think in this aspect, when we do the after action report, we'll be going back, revisiting, we'll be rewriting it. And I think the product we're going to have is going to be much more sound and valuable to the future when what I'm hoping is somebody else gets to use it. In one of these responses, it's not me.
Yeah, yeah, I completely understand that. One thing, and I'm going to come back, that my mind's kind of going to some other questions about, such things like, it was brought up earlier about, Debbie talked about, making sure that people had not only desktop, but laptops, and the laptops were not just, system-based devices for, Microsoft type applications, but also telecommunication devices as well. And they were tied into the telephones at the office and so forth. Not all of us operate off of laptops. Some of us still do have desktops. So I am kind of curious, and this might be part of our conversation for tomorrow, is as we think about what's next and how we plan for what's next, how are we thinking about modifying our work? And Tracy, I'm going to come to you with this question because, some of what you talked about is outside of your control. You've got citizen-facing, community-facing work that you do every day. you don't always have the flexibility, perhaps, to work from home across your team with everything that you need to do. You have to be in an office, at least right now. You know, we might be able to think about how some of the services may be re-engineered, but those haven't been re-engineered yet. And so I would be interested in knowing, from your perspective, Tracy, what has been some of the most challenging aspects of this crisis? You talked about the questions that don't have answers, and you've got to show up and have those answers. You talked about the customer-facing, citizen-facing work, and so you've got to be in the office and sometimes be at risk or increased risk because you are dealing with the public, and you don't know, to Kevin's point, if they were out at restaurants and bars and public gatherings and you're serving them because of the work that you're doing out of the county business. What have been some of the most challenging aspects of this crisis for you?
I'm very fortunate that we're a smaller county in Iowa, so at this crisis, this is a good thing. I think just working with the public, communication, you know, just trying to keep the place safe, you know, as safe as possible. Sharing information is, in a situation like this, is very key. Keep calm and ask for help from other associations. I thank ISAC and the Treasurers Association. When I reached out for questions, you know, they were answered. You know, I just thank everybody for coming together.
Yeah, the collaboration, you can't beat collaboration, especially in times of crisis. And so I appreciate that. And Ryan and Debbie, I'm going to come to you with the same question regarding the biggest challenges. What Ryan, had been some of your biggest challenges when it's come to dealing with COVID-19 and you know, this year?
I would say there's three things really that I've kind of identified, and the first would be just anticipating the duration and the effect that the virus will have, and making sure that we're prepared for what's next, even though that might be unknown. The really, in the early part of the pandemic, the unknown was, you know, crippling some people with fear, and having a plan to move forward and addressing those fears and overcoming those and adapting to kind of the new reality was pretty key in that. Another thing is something I get refueled by is networking with my colleagues across the state. And, you know, with all these conferences going virtual or getting canceled or what have you, you know, that collaboration hasn't happened, or that networking hasn't happened necessarily in person. So that's been pretty difficult. And then I guess lastly would be just trying to be the kind of husband and father my family needs, with, you know, the increase in workload and time constraints on things, and, you know, with school being out, and, you know, the kids are needing that interaction when you get home, and, you know, you're just wiped from the day. So that's been a big challenge. But now that school started back up again this week,
Do you have 3 kids, Ryan? So
I do, yes.
Let me tip my hat off to Ryan. You have 3 kids. You help them. You're trying to work from home. It's challenging for us. Just the lack of the face-to-face communication with not only our staff, but our members. How do we keep our members engaged? And we have to understand that our members, they're dealing with the same challenges we are. And so what we thought was the best way for us to deal with this is to be a resource. We have to understand, as I said, they're dealing with the same challenges we are. So let's try to be a resource for our members, sort of a one-stop shop if we can, and just try to help make their jobs easier. Part of the challenge is, as I said, maintaining these relationships. We, at our events, our legislative conference, we're used to seeing friends. Our members attend educational workshops to assist them with their day-to-day work. And of course, so we've had to learn how to redo things. We had to kind of retool, if you will, our strategy. So at this juncture, we're focusing on being, as I said, a one-stop shop for our members. And that includes enhanced e-learning and having the appropriate technology and platforms in place to accommodate our new norm. And that's constantly changing. As we're learning these new platforms, we have to train folks. So, it's been a challenging, but I have to say, through it all, we've learned a lot. We've learned how we can, how resilient we are, especially our staff.
Yeah, that's great to hear. And for folks that are dialed in, you're hearing some common, sentiment here around collaboration and as informed as possible. And the ISAC team does a great job in coordinating and facilitating some of that collaboration across all of Iowa. And NACO does a great job as well with facilitating webinars on all things COVID. What's coming up in the next version of the CARES Act. Now the HEALS Act, the amendments to the CARES Act, and what will no doubt be amendments to the HEALS Act once that gets passed. And so NACO.org does have a lot of resources that you certainly are welcome to peruse on their site and use for your benefit within your counties to learn more about whether it be funding, which I know that your governor has recently announced how funding is going to be passed into the counties and allocated for various usage, because I know as well that the CARES Act and supplements thereof have not been focused on county specific. There hasn't been any direct funding to the counties, but your governor has recently made announcements, and Rachel and the team at ISAC can certainly help you understand what that looks like if you're not aware, but I suspect most folks are aware of that. But feel free to use ISAC and NACO as resources, because that is exactly what they're here for. One of the questions that came in was a comment that not everyone agrees and feels the same way when it comes to going back to work or showing up in an office with other people. And the question is, how do you handle the conflict? The challenge and the conflict that people have in the office, where some of the individuals feel as if everyone should work in the office, and yet others don't feel that same way, and they do feel, as some of you have mentioned, as productive, if not maybe more so, working from home on some days or maybe all days. Ryan, as you think about that, I know you've got a small team, and your team is in the office. Have you had any conflict with your team about working in the office, not wanting to work in the office, wanting to have some of that work changed around a bit? Any of that conflict or pressure coming out of your team of 6 people?
No, not really. In talking with my employees, they're all wanting to be in the office and do their jobs, for whatever reasons, whether if there's people at home that might be a distraction, or if they just feel more productive being in the office. But again, the nature of our positions is you kind of have to be in the office in order to get the work done. And like I said previously, some of those tasks absolutely have to be done in the office. Some that we could try to think about doing remotely would then cause another staff member significant work in order to provide the information to that person. But I've been pretty fortunate. I haven't noticed that in my office, and yes, I can't speak for other departments, but yeah, it's been pretty good in my office.
And Tracy, what about you in Cass County? Any kind of conflict or challenge coming from individuals about a level of anxiety in the office or conflict about working in the office or away from the office?
We didn't so much have conflict. We really worked as a team, you know, and that just the communication we had, and some staff, you know, they felt about everything, and we just worked through it, and it worked. There was conflicts through other offices, but as I told my staff, you know, you don't work for them. Our office is different, you know, so you kind of have to separate all that also. But yeah, for the most part, we worked as a team and got through it very well.
Yeah, I know that we've got individuals that feel differently, as the comment and question here states. You know, some individuals do want to get back into the office, and you know, we've made a decision that we're not going to do that as a team. We're not going back to the office, and there are some that feel, no, I need to stay away because of maybe some preconditions that individuals have or family members have, and they're certainly concerned about them. And we look at it from just an individualized consideration perspective, and each person is unique, and the job function that they're doing certainly needs to be kept in balance as well. That's part of the variable making decisions like this. And Debbie, it sounds like you have that type of kind of decision-making filter as well, the way you described it, as it is a privilege to be able to work from home, and there's a trust level associated with that. And it sounds like some folks are making their decision, do they want to be in the office, not in the office, and they've got that latitude to make that happen. Do you have some folks that are kind of pushing back and forth against, you know, those two sides of everybody should be in the office, or, you know, we all should be out of the office to stay safe for us and our families and our community?
Yeah, for us, we've made it an individual choice. We really did. So we, again, 100% of our staff is working from home. We made sure that they had the tools, the connectivity to work from home. And we even provided them with, you know, they have their desktop at homes with double monitors. They were welcome to come and pick up those monitors, their desktop, their chairs, whatever they wanted to set up an office at home. So we wanted to make sure they had the tools. Yeah, there were some who were very uncomfortable about coming into the office, but as we said, that's your choice. We knew that some folks had to catch public transportation. They didn't feel safe on public transportation. But what we wanted to do was to assure staff that we've done everything possible to maintain safety within the office. We took every safety precaution we could, and we conveyed that message to staff. So if you want to come in the office, be assured this is probably the safest place you can be, because we had a professional cleaning service come in once a week to clean the office. We had our facility folks every single day washing down doorknobs and elevator doors, and so we were fairly comfortable that the office was safe. So those who want to come in the office, we tell them, feel free, come in the office anytime you want. And those who are not comfortable coming in the office, stay home. So no one really has a problem. We had some staff, as I said, have families out of town. And during this crisis, they wanted to be near family members. And so they can go home, feel safe, and still work effectively, as long as we provided them with the proper tools. So we haven't had any problems. We have a handful of folks who are in the office. They make it clear that they work better in the office environment. They do feel comfortable, and we allow them to do that. And again, we're following the executive order in DC. DC says it's okay. Whenever that changes, then they don't have a choice any longer. But right now, we're giving everyone that choice, and it is up to their manager. If for some reason they believe that a person needs to be in the office, then it's up to their manager, because it's based on performance. And we also want to be certain that it doesn't put an undue hardship on other staff members for them to be able to telework. So it hasn't been a problem for us at all. We're very flexible on that front.
Yeah, that's great. And Kevin, how about you? I mean, I would suspect a lot of the folks, the 60 plus folks you have, they probably mostly need to be in the office, or it'd be preferred. But what about the possible conflict or challenge. Anything that you're seeing out of the department?
Well, I think what we were able to do is we quickly got, we have contractual obligations with some of our contracts and grants. And so they had mandated service delivery modes that need to occur. One of the things we were thankful, we requested an exception to the contract so that it used to be required to be face-to-face or in-home, we could do it on a virtual basis. So we went through and kind of did an assessment. Some of those came through naturally, which then gave us a greater flexibility on who potentially could work from home. Another part that we did is I had an individual who had worked from home and came up with just some things of managers that were going to do it. So for example, in the midst of all this, we unleashed the Microsoft Teams concept. We had never used that software. We needed that internal connection communication tool. So what any supervisor did with their entire team, whether they were in the office or at home, at 8:15 every morning, they had a team meeting. What we wanted to establish was the routine and the expectation that even though you're at home, that's still you're going to connect and you're engaged in doing your work. And so it was kind of some of those types of things. And I think the other part as far as working within the office is that when this started, we explained to staff that our communication plan was when we got an active case, we would share that with the entire staff. We would give no details related to it. We'd be directly maintaining the confidentiality of the individual case. And those individuals that needed to have concern or were identified as close contacts, we would have direct discussions with them. When that first case came through, that's exactly what we did. We followed it through as we said we would. And I think that built just a level of confidence and understanding that we were not going to be withholding or not disclosing things that would cause this work environment internally to be unsafe. And I think it was very important that we held to and we followed through on what we said we would do. And I think those were all pieces. And so, at this point in time, I've been impressed with staff as they've come back in. They've adapted. Wearing masks is not an issue. Everything we've asked of, they've been fairly compliant to do it. We've had very few issues. And I think it's kind of what they understand, and it's sort of their, I hate to use this, the new norm, but I think they're beginning to understand what they can proactively do to protect themselves. And I think the real motivation with it is they interact with others in the community, they can explain to them some of the things public health is doing. And kind of how do you keep yourself safe?
Yeah, and I think it is some of that perspective that is so important. Just the consistency of the communication, just the perspective that people have relative to the work that's in front of them, and that everything of what's being done to help keep them safe, so that other people can be safe as well. We've got just about 10 minutes remaining, and I want to just kind of go back, one more set of conversations here across the panel, and that is just the magnitude of this. For some of us, we may have all experienced the management impacts that seem to, at this point, be very minimal compared to what we're dealing with now. But with H1N1 and some of the other big issues, there may have been some other big impacts that we've had. We've had some financial crises over the years that have had some big impacts on our communities and our economies and the way in which we think about our work and the people that are part of our work. But probably nothing like this. And so, Kevin, I'll start with you, and we'll just kind of go down the line here. Have you ever experienced anything like this? And what are you taking away at this point in the response and recovery in terms of a critical lesson learned, either just personally, professionally, relative to the rest of your team, the community, any big takeaways, aha moments? But have you ever experienced anything like this?
I think 10 years ago or so, when we were going through the H1N1 situation, but that was so much dramatically different, is we did not have the lead up to it with all the hype and the sensitivity. That basically came through is what it was. And really by the point in time, we saw monitoring of it, but the true active response came about when the vaccine was available. That was really the point of the time that would probably the general public really became, there was a public health issue that was out there. And so our really proactive thing was we were already to the point of providing the solution or an option for people to protect themselves. So I think it was much different. And I think part of it that I had to explain even within our county EOC is that they're very astute and very good at dealing with these types of issues and emergencies. However, with the flood, they could see where the water was at. When we have a tornado come through, they could see where the damage is at. when you're talking COVID-19, you're not sure. I mean, anybody that you're around is actually kind of a suspect that could potentially be carrying. And so it's how do you continue the interaction, but also protect yourselves. And I think really on a personal basis, I think what it amounted to is that, I actually, right now, what I've been thinking about even sitting here today is I am afraid that I'm going to be so in tune with this Zoom option with dual screens that when I actually have to go to an in-person session and sit there, I don't think I'm going to have the mental tenacity to focus in on a single topic and to really gain what I could from that in-person experience. Because my mind has been, it's a constant sitting in the back. You're always thinking of something else. And I always take the, inefficiency, as I sometimes say, multitasking, which isn't always the best for me either. But I think just mentally recovering, managing that, and then recognizing it as I begin to move forward and things go back to a different state of normal.
Yeah, it is so true. It's interesting these times for sure, and working through it, and then what might come of it because of what we're experiencing right now, technology-wise and interactive-wise with other people. And so I appreciate that, Kevin. We're going to build on some of these conversations going into tomorrow's session. And Tracy, what about you? Have you seen anything like this before? And what are some of the big takeaways and kind of lessons learned or just thoughts that you're having at this time of the crisis?
No, I've never experienced anything like this prior. H1N1, the only thing I recall about that is being in rural Iowa, people wondering if it could be transferred from humans to pigs or pigs to human. I will continue to base my decisions off of the CDC recommendations and other treasurers throughout the state. ISAC, NACO, whatever information I'm in need at that time. I'll talk to the local nurses and other county officials. I've definitely learned a lot from my staff and about them and about other leaders in the county. I think it's been a great learning experience. Not one that we ever want to deal with again, but just learning from everyone, and communication is very key. Keeping calm, I think that helps your staff focus a little bit more. The calmer you are, the calmer they're going to be. Communication.
Yeah, absolutely. And we're going to wrap up with some of that too here in just a couple minutes. So, Ryan, how about you as you think about the past number of years? I mean, anything come even close to rivaling some of what our experience has been like in 2020?
No, I've never experienced anything like this at all. And, a quote that comes to mind from Mike Tyson is, everybody has a plan until they get punched in the mouth. So that always keeps coming to mind. What each day brings is who knows, but it feels like that at times. What new thing is going to get thrown at us? How are we going to respond? But yeah, like Tracy said, a lot of the communication is key. And for me too, finding out who I can go to that's going to help, make us be successful. And I've also found out who won't help us make us be successful, and avoid those people as well. And one thing I've been really happy about is my staff response. In the last year, I've hired 3 new staff, so half of my staff's new, and this has been kind of a bonding experience for us. You kind of go through some hard times, and you draw closer together, and you make a better team out of that. So those are a few things that I've learned.
Yeah, I appreciate that. Thanks so much, Ryan. And Debbie, anything come close to rivaling this? And what are some of your critical thoughts at this point, and takeaways and perspectives?
No, like the others, I've never experienced anything like this, nothing even close to this. So this is, the only word I think of, this has been crazy. But, we handled it like we would any other, critical issue that come to us. And fortunately, having attended the High Performance Leadership Academy, I remember what Colin Powell always said, when you define the problem, he said, you know the problem, you establish or enumerate the criteria or constraints, you consider all the alternatives, collaborate with others, identify the best alternative, and develop and implement a plan of action. And finally, as he said, evaluate and monitor the solution and examine feedback when necessary. And that's what we've done. That's how we've handled this, right? This whole crisis. This is how we started handling this from the beginning. It worked for us, and this is how we'll continue handling this. Our staff, I have to tell you, they've been amazing. What we recognize is that we have a fantastic core group of employees that prove that we can get through anything as a team. It shows us how committed they've been, how creative they can be. It also showed that we can pivot. We can pivot when necessary, which we've had. And while we've had our policies and an emergency plan in place, it's not perfect, but we did have something in place in terms of some disaster recovery. It showed us that, it gave us the opportunity that we actually live through a crisis in live, like live TV, you know? So we didn't have to think about it. Now it gave us the opportunity. We realized where we had gaps and the opportunity to make improvements or make adjustments and allow us to be better prepared, and even more the next time. Hopefully there won't be a next time, but if so, we'll be prepared. We were in good shape in terms of our technology, our payroll system, finance system. A lot of our systems are all web-based, so we can do most of our work through the web or even on a mobile device. And that's one of the reasons we were able to telework without any interruptions in our day-to-day activities. So the staff has just been amazing. I can't say enough about our staff.
Yeah, and you know, I think we see the commonality. I mean, none of us have really experienced anything that comes close to rivaling the challenge that is in front of us at the scale and the scope and the impact that we can see, you know, every day. And yet at the same time, every day, our teams, your all's teams, continue to show up and execute the business of counties at an exceedingly high level amid exceedingly high levels of challenge and headwinds. And it is a testament to who those people are, the engagement they have for the work that they do because of the mission that they have to serve those of the community and of the county. And because of that service, it enables that county to thrive, that state to thrive, and our country to thrive. And so it is great to see the capability of these individuals coming together as a team amid the great number of questions. Tracy, you mentioned that there's a significant number of questions at the very beginning. There's still a significant number of questions, and we then implement best leadership practices. We listen to people. We have a sense of empathy for people, compassion, concern, care for those individuals, as well as the work that we do every day. And we prioritize that work. We understand that work, and we think about that work, and we identify how best to execute that work. And we implement new pieces of technology or processes or procedures or practices so that we can get that work to the people who need it, the beneficiaries of the services and products that you offer through the business of your counties. And we might need to think about the implementation of certain collaboration tools, whether that be Microsoft Teams or GoToWebinar, or fill in the blank of whatever, Zoom technologies or other type of telephony services and collaboration services. And as you think about the work of your county and you're prioritizing what it is that your business is and how you can plan for the next challenge, the next crisis that we will face, it is interesting to think about, well, what if our services had to go online for a couple days, for a couple weeks, for a couple months, for a year? What would we need to have in place? Would people need to have laptops? Maybe we can't get everybody laptops now, but when at some point in time will that need to be a reality? When will we need to have our technologies tied in from our systems on our laptops to our telephony services in our offices and with one another wherever it is that we reside. Now is the time to be thinking about that and planning for that. And if you're not exactly sure where to start, that's what the ISAC team is for. The ISAC team can help collaborate and coordinate who is using Microsoft Teams, who's using some other different types of technology. And NACO can help with that as well. NACO does a great job with coordinating and collaborating of those type of services and those types of products in use to strengthen America's counties so that we strengthen the United States in the way in which we go about our work and maintaining the economy that we all benefit from. And so I want to thank the panel for today. We're going to come back tomorrow, so hopefully you'll all join us again tomorrow. But Kevin, Tracy, Ryan, and Debbie, thank you for participating today. We look forward to carrying on this conversation tomorrow. And we're going to start with the workforce. We're going to start with what you all just ended with today. We're going to start with, what is the value of the workforce and how they did rise up to meet the occasion and overcome some of the challenges and still are overcoming those challenges. And what are we going to be doing to help them even more so going into the months ahead and as we start thinking about closing out this year, going into next year. And so on behalf of ISAC, I wanted to thank everyone for participating today. And I certainly look forward to everyone tuning back in tomorrow. Feel free to bring your questions back to us tomorrow. We'll engage in another 90-minute conversation around leadership practices in times of crisis. So thank you, everyone. Enjoy the rest of your day. We'll see you again tomorrow. Take care.